Hello, I'm Dr Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. I'm going to talk to you today about BodyTite with BodyJet.
What is BodyTite with BodyJet?
So BodyTite with BodyJet is a body contouring procedure. It's a procedure where we can tackle small areas of body fat. We can use the BodyJet system to remove that fat very safely. It's a very unique way of liposuction. So rather than trying to suck the fat out, we're actually using a jet spray of fluid which releases the fat cells, which then come out very easily from the body, from the area where we're treating. The BodyTite part of the treatment is where we're using a radiofrequency, internal radiofrequency, what's called bulk heating, to contract the tissue, the fat tissue, the space where you've removed that fat, to contract and pull the skin in. So it's a body contouring procedure where we can remove fat and at the same time get skin contraction or skin tightening.
Who's the ideal patient for this treatment?
The ideal patient for a BodyTite with BodyJet procedure is someone who's looking to have a small area of fat removed and the skin contracted. So that could be typically a small roll of fat in the lower abdomen, maybe that post-pregnancy little roll of fat that's just sitting there. You can't seem to shift it with diet or exercise, and there's some laxity of the skin. So even if you lose a bit of weight, it sort of still remains there. Or it could be the upper arms where there's a little bit of excess fat there, or the bingo wings that hang over your bra, little bra folds, or even the little folds around the flanks here. Sometimes even a little bit of fat in the inner thighs or around the knees. These are all small areas that can be treated with this system quite effectively. I tend to find the best age of patients is probably the younger the better. So I'm talking patients maybe in their 30s or 40s or 50s. Why? Because they have less skin laxity associated with it. So we're going to get a better contraction, a better result after we've removed that fat. There's a sort of quicker healing as well.
Is the treatment painful?
So the treatment, we use anesthesia, injectable anesthesia. In this form, it's called tumescent anesthetic. So this is injected in. It's actually the BodyJet system that sprays that anesthetic into the tissues as it's releasing the fat. That's the most effective way of getting that tumescent anesthetic fluid into that area. So it's a pretty painless procedure to have that done because it's anaesthetizing as it goes.
What is the aftercare and recovery time after BodyTite with BodyJet?
So this is a sort of minor surgical procedure. It's done in clinic in an operative way. And the most important thing really is that you're going to get some swelling and bruising after this procedure. And it's the swelling that can come following this procedure that we want to prevent. So what most people, or what we advocate, is that you wear a compression garment. This is an elasticated garment that is bespokely fitted to you, to your size of you, either like a corset to wear around if we're treating the abdomen, or some shorts if we're treating the legs. And this corset, this elasticated garment, pushes the fluid out of the area that's treated and helps that swelling go down, and it stops more serious swelling occurring after the procedure. Most people are wearing these garments for a week or two after the procedure. There can be some bruising and swelling and some irritation of the skin, but these minor symptoms usually settle very quickly within a week or so.
When are the best results seen?
So there's an immediate result in that we've removed some of the fat, obviously, in that area, and there will be some swelling, but you can see a reduction straight away. However, the skin tightening effect is very gradual, and that's progressive over around about 6 months. Sometimes even longer, the skin continues to contract. And once you get that contraction of the skin, then the results are long lasting. We're talking many, 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 many years. The skin can continue to age and you can get some elasticity. Other factors that could influence it is if you gain a lot of weight, then you're going to get that volume, you're going to get that fat back, you're going to get that laxity back because of that extra volume. So when we do these body contouring procedures, it's absolutely critical that you don't gain weight afterwards. Otherwise, you're going to lose the benefit of that treatment. Clearly, if we're treating a fold of fat after a pregnancy and you get another pregnancy, then again, this may cause a further problem. So in that situation, we normally say wait until after future pregnancies if you're going to have these sort of treatments. But generally speaking, we're talking at long-lasting, almost permanent results if people are able to keep a healthy body weight and slow down the aging process. Then things are going to be long-lasting.